I have like 7 or 8 diagnoses of infertility. It was too much. It was overwhelming. No single doctor can help me with all this. Even if I went for the procedure or the surgery, there's no guarantee. Exactly. There was no guarantee that I would conceive naturally or through IVF. So I just want to put it out there that if you're going through this phase, this, condition, don't lose faith.
Don't give up.
Don't give up. Just believe. If you want to seek medical help, go for it.
Yeah.
Seek medical help. There are a lot of medical help out there. Could be surgery, it could be, hormonal therapy, or all kind of, depending on your situation. So just go for it.
Yes.
And keep trusting God.
Yes. Yeah. Hello and welcome to another episode of Life Bloom. If you're new here, welcome. My name is Joanne Oyedoko. And with me today, I have a very special friend. In a bit, I'm just going to let her introduce herself. But before we dive into it, I just want to take time to thank everyone that has watched the videos on the channel, that have subscribed, share, comment. It means a lot to me. Thank you for engaging in the comment section. Truly, truly appreciate it. Welcome to Life Bloom Studio.
Thank you.
I'm just going to let you introduce yourself to our audience.
All right. Thank you so much. I'm so glad to be here. My name is Folashade Adesaalu, and I'm a mother of 3, and I have suffered endometriosis for like my entire life, for over 20 years before I was finally diagnosed of endometriosis. So it's a long, very long journey for me.
All righty. Thank you so much. She's my friend. We go to the same church. And the funniest part is we go to the same church and we're also in the same women group and also in the same connect group. And we never knew that we both had endometriosis. And this further tells you why we need this awareness. So let's dive into it. Can you share a little bit about your journey with endometriosis and when were you diagnosed?
So I started my period at the age of 12. I remember that I used to have very heavy period. Even as young as I was then, I experienced every period with excruciating pain. Very painful period that most times I will not be able to go to school. And I let my mom and my sister know about this situation, and they were like, well, we experience it too, so there's nothing you can do about it. You just have to manage it. So I continue managing the pain until like when I got to the university, the pain just continued. It was excruciating. It was very bad. Like every month I bleed for like 6 to 9 days every month, and there are some times that I will pass out.
Wow.
Yes, very painful period. Because I grew up with it, I saw my sister and my mom experience the same thing. So
really?
Yeah, there's little they can do about it. Like, okay, it happens to us, we did not die, so you just have to manage it.
Oh wow.
Yes, I grew up seeing my mom going through, not really in pain. My mom was not really in pain, but she used to have very heavy period. Very heavy period. Like my mom used to use like multiple pads in one day.
Wow.
So the same thing happens to my late sister. She also experienced very heavy bleeding. Her own is very terrible. Every time during her period, she usually go to the hospital. They take her to the hospital. We cannot manage our own pain. So I grew up experiencing, such situation, and like they'll tell me your own is not different. So for me, I think my own situation is genetic, because it happens to my mom
and your sister
and my sister had it. So it was a very terrible pain. The pain includes lower back pain, and then during my period I used to have very terrible migraine and fever, and then I used to throw up. I will not be able to eat anything. I can't keep anything in my stomach, whatever. I just throw up. It continues like that until when I got to the university. I tried to I need to see a doctor, seek help. And the doctors, the OBGYN just told me that, you see, you just have to manage this pain with, pain medication. So I was just plain medication. Every month I was given, I can't remember the name of the pain medication. I take that.
Buscopan?
Yes. No, Buscopan doesn't work for me then. I remember I used Buscopan for so many days, but it never worked. Felvin. I think it's Felvin or Feldin. Yes. So they asked me to take Feldin twice in a day, and it helps a little bit. After like 3 days, the pain can come back. And I now realized that the length of my period now continues. Like, it used to be 6 days, then it increased to 9 days, then to 11 days.
Wow.
Heavy bleeding every month. And it got to a time that my cycle is very irregular, like the regular 28 days, 30 days cycle. Mine is about 35 days, sometimes it's 28 days, sometimes it's 25 days. So it just come. I cannot track my ovulation. Well, I wasn't really bothered then. I said, okay, since I was still young. Then the second year, I started seeking medical help. The first doctor I met, they asked me to do some, fertility tests, like fallopian tube tests. I can't remember the name now. I did the fallopian tube test to check if my fallopian tubes are open. And I did some ovulation tests, and I was told I wasn't ovulating, and one of the tubes was blocked.
Wow.
So then the journey of getting treatment started. The doctor, they advised that I go on some ovulation medication, Clomid. I was given Clomid, and so I started using Clomid. I think I used Clomid for like 2-3 months. After then, no pregnancy still. So someone else, one of our family members said, oh, I know another doctor is very good. This gynecologist is very good. We need to come and go try another person. So I moved from one doctor to one. I keep changing doctors.
Yeah, and that's very common with endometriosis patients.
Exactly.
You have to just keep trying and seeking help until you get.
Even as I was moving from one doctor to the other, none of these doctors diagnosed endometriosis. None.
Wow.
They were like, okay, you're trying to get pregnant, you're not getting pregnant. One of your tubes is blocked, the other is not, and you're not ovulating. We ask to first of all treat the ovulation, make sure you are ovulating. But my every period is still there.
The pain
is still there. I was just not getting help that I really need. It was really, really tough moment for me.
Frustrating.
Very, very frustrating. I couldn't concentrate on my job. I wasn't happy at home. And another thing is, I experienced very painful intercourse.
Yeah.
Very painful intercourse. It was like a punishment to me, So it was really bad and really hard on my husband. We kept changing from one hospital to the other. And 4 years into our marriage, so one of the doctors advised that we should try IVF because
So was that when you discovered you were diagnosed with endometriosis?
No, that was not when I was I was diagnosed. Like 5 years into my marriage, I met another doctor, and they said they are going to do an vaginal ultrasound scan for me, and they did that, and the doctors, they came up with that I had PCOS.
Okay.
That they saw a lot of cysts on my ovaries. I remember then, after the diagnosis of the PCOS, I was also diagnosed of chocolate cyst. I don't know what that is. They call it chocolate cyst. Very big cyst on my right ovary. Very big cyst. And it was very painful. So they recommend that they are going to do a procedure in which they're going to drain the fluid from the cyst. As long as I menstruate, the fluid will continue to go back into the cyst. So I did that procedure for like 4 months. Wow. Every month, they insert something in through the vagina, they use the camera to, puncture the cyst and take it was a very painful procedure. Very painful procedure. So they drained the blood from the cyst. Now, after like 4 months, I wasn't getting any relief. The pain was still there. The cyst was growing bigger. So then a friend of mine, she was also going through fertility issue. she now told me that we should attend one of the clinic in Lagos where they're doing some seminars about fertility treatment and all that. So we got there, and there are doctors from UK. They were consulting with other patients that have fertility issues, and I met with one of the doctors, and I told him about my problem, that this is the procedure they've been doing for me, this is what they said. So from the doctor, from the first time, that was when I heard about endometriosis. And the doctor said, possible you have endometriosis. That you know about endometriosis? I said, nobody has ever mentioned that to me, but these are my symptoms. And the doctor said, these symptoms look like you have endometriosis. So you have to go back. We have to do a procedure, because there's no way we can just say you have, it's not like a blood test. You have to do, you have to see through your pelvic area and see what is going on there. So I scheduled an appointment with the doctor, and I went in there, and they do laparoscopic surgery. That was the first time I was diagnosed with endometriosis, and they said it's very bad.
So this was like how many years?
That was like 21 years.
Oh my God.
Yes, because it was diagnosed when I was in my 30s, and I started my period like 12.
Oh my God.
It was over 20 years.
Oh my God. Oh
my God. I suffered that pain for more than 20 years.
Oh my God. So
I was diagnosed.
Yeah. So I know that you've mentioned some symptoms, early symptoms that you were dealing with, like the heavy bleeding, back pain, and all that. But a follow-up question to that is, was there any way it affected your emotions and your mental health? Because even though back then mental health wasn't really a big deal, or wasn't widely talked about like it is right now, but because right now that we're trying to create the awareness, mental health is a big thing. And for people that are dealing with endometriosis right now, it's a thing for them. For me, going through it then, I used to have anxiety. And the anxiety comes from the fear of, how will this pain present itself this month? I've interviewed someone that said it actually put her into depression. Did you have any similar experience?
Yes, I do. Especially the anxiety. It's like comes every month. Like, my period is coming. I feel so depressed. Like, for the first 3 days of my period, I don't go out. There's no way I could go out because of the bleeding. There's no way I will not mess myself up outside. So the bleeding was so much that I just have to stay indoor. I could not do a lot of things my friends were doing back then. The first 3 days, I don't go to school. I don't go to my job. It affected me in so many areas, financially, everything, physically, my relationships, my marriage. It was really bad. So in all areas, it affected me, and I just have to deal with that pain every month.
So I know that when you were talking about your story, because my next question would have been, how did endometriosis affect your journey with infertility? But you've kind of talked about that, and as we go along, I know that there's still more to come that you're going to touch in that area. So were there specific moments that stood out in this infertility journey due to endometriosis that stood out to you that you can remember vividly? Was it surgeries that you went through, like the procedure that you were going for that you did for 4 months? Were there specific?
Yeah, you see, that particular procedure, it was so devastating, because having to puncture someone and drain a lot of blood, and then that procedure is not like it's the cure. You coming back the following month to do the same procedure. So that procedure will only give me like few days of relief. Then I go back to the same cycle again. And the doctor vividly told me that as long as you menstruate, that chocolate cyst will continue to come back. It will fill up every time you menstruate. So it was really frustrating. It drains me of everything, energy, life itself. So I went on and on with that procedure until I met this doctor that diagnosed me of endometriosis. And when he told me about the endometriosis, he said, can I be very truthful with you? Your endometriosis is very bad. Like, it's like a stage 4.
That was what they told me too.
Yes, The doctor told me that it's like a stage 4 endometriosis. I was like,
Mm.
what stage 4 endometriosis? He said, because all your pelvic areas has these tissues. You have a lot of scar tissues in every part of your pelvic. The ovaries, the tubes, the disc, and all of that. So you have, even though you've never been pregnant, you have a lot of scar tissues that will not make you to get pregnant. And then I also have fibroid. Multiple fibroids everywhere. So the lining of your uterus is bad, the outside, the ovaries, the tubes are bad. So the chances of you conceiving naturally is very slim. Even if you're going to go for IVF, we need to do a surgery
to clean it up.
And before I met this doctor, we already did one IVF, which wasn't successful, of course. The doctor advised that I need to go for surgery, and that it's likely that they're going to take out one of my ovaries, because that ovary is really bad. The multiple cysts on it, and from the procedure that I had done earlier, they have punctured the cyst, so there's so many inflammations everywhere that if I don't do that, that can degenerate to something you call endometrioma cancer or something like that. So that I need to go for surgery.
So before you get into the issue of surgery, which we're going to get into, were you ever anemic? Because for me, that was one thing that I had to deal with endometriosis too. I was really anemic. I would be so pale. Like right now, I'm even better. You can see blood in my palm and everything. But before, everything would be white because of I'm losing blood and everything. You know, when I had my baby and the surgery that I had after they took out the baby and everything, they gave me, I think it was, I'm not sure, it was 7 or 10 pints of blood.
Wow.
Yeah.
Funny enough, I was never anemic.
Really?
Honestly.
Wow.
Funny
you
enough,
are so blessed.
I was with that amount of blood. I was never anemic.
Wow, you are blessed.
Yeah.
You're blessed, my dear.
I was never anemic. The bleeding was so much that sometimes it's not just ordinary blood, to be like a clot. You know, has a very big clot. Has a very, very big clot.
Endometriosis
like, it will be like you want to bring out baby, like big clot.
And then when that clot is coming, then you feel that pressure and that pain.
You feel it like a labor pain.
You guys can see why we call ourselves endo warriors. Because for you to have gone through all this, and honestly, they tell us some of the things that they say when you go to see the doctor is that you have low tolerance. It's the other way. Usually our tolerance for pain is very high.
Very high.
Because of this pain that we've dealt with endometriosis.
Exactly. The pain.
This is why we are endo warriors.
The pain,
we are
especially
real
when you now have, in my own case, my ovary became enlarged, as in very big. I can't remember the centimeter they call it again. Maybe between 10 to 20 centimeters. I think normal ovary is not supposed to be more than 4 centimeters. Mine was really enlarged. I could feel it.
Wow.
Very enlarged. And that was when the doctor told me that you need to go for surgery, and it's likely they're going to remove this ovary. So he gave me different options. Either after they clean you up, it's either you go through IVF or you go for, if your eggs are still okay, because it's like the quality of the eggs are not even good again, you know, because of the years that has gone by, you know, years that I've had endometriosis. You know, it's like internal bleeding. You're having internal bleeding and it's causing a lot of inflammations, a lot of scar tissue. So the possibility of even carrying a baby with that condition is really very slim. So that was when I was like, okay, so I'm going for a surgery and anything can happen. They might remove one or both ovaries. And at that time, they told me that the tubes really bad. They're really inflamed, and there's nothing much I could do naturally except through surgery. So the outcome of the surgery that will now determine what further procedure that I will now do.
All right. So we'll come back to the surgery. But before we get into the surgery, while you were dealing with this pain on a regular monthly basis, what were the things that you were doing to just manage it? And what actually worked for you? Because in my own case, what worked for me was take a pain medication and then have multiple showers. And then hot water bottle will constantly be my, in my house, I think I have hot water bottle all over the place. You understand? Those were the things I was using to manage it. And I also know that lifestyle change in terms of diet,
That's
because
very true.
inflammatory
Yes.
foods are not
Yes, because I remember I was told to cut out fried food,
yeah.
sugary food, anything that is sugary. And what actually helped me then, I remember, it's pain medication,
Okay.
hot water bottle, like you said, and a lot of exercise.
Okay.
So I realized that anytime I try to run,
Okay.
walk few kilometers, and exercise really helped me. Exercise, pain medication, and hot water bottle. Then, like you said, I take shower like multiple times a day. Yeah, that's what basically helped to reduce the pain. Not like the pain was not there.
It wasn't
It's not
as
like
if
the
the
pain
wasn't
went
there.
away,
Yes.
but it reduces the pain
My
for
sister.
a while.
You can say that again and again. All right, so let's get into this surgery. So, how many surgeries did you do?
Funny enough, I didn't do any surgery.
Really?
I recently did a surgery.
God,
2 years ago.
It's so good. With all those that you said, with your ovary enlarged and everything, I need to hear it.
I didn't do any surgery.
Wow.
So I decided, after I met with the doctor and he told me that I need to go for a surgery. So I was in Nigeria. So I consulted with my primary doctor and with my other gynecologist, and I was told that with this level of diagnosis that you have, that if I have the money, that I should travel abroad for the surgery.
Okay.
And I said, okay. My doctor recommended a doctor friend in India.
Okay.
And that I should go to India for this surgery. So I agreed and I said, okay, I'll go for the surgery. I got a visa to go to India with my husband. We got the visa. That was 6th year of our marriage. Do you know that the same week after I bought my ticket to India, the same week that we were supposed to go for the surgery at India was when I discovered I was pregnant, naturally. Yes.
Wow.
Yes. That same week, I have never been pregnant. So I don't even know the symptoms. I thought it was symptoms of I was still having pain, still throwing up. I was throwing up and I was still having pain, headache. I thought it's the same symptoms of my endometriosis and period, not knowing that it was pregnancy. So one of my colleagues back then at work now said, with this pain, fever, headaches, and weakness of the body, can you just go for pregnancy test? I said, pregnancy test from where? No, it's not going to. No, it's not pregnancy. It's just symptoms of my, my monthly period and all of that. They said, but you just finish it. I said, yeah, and it cannot be pregnancy because my period just ended like 3 weeks ago. So it cannot be pregnancy?
Wow.
So she insisted that I should go for the test. So I went for blood test and they said, what? It's positive, it's pregnancy. I was like, how? This is just a miracle. I don't know how it happened. It's with all the diagnosis, they told me the lining of my womb is really bad. The pregnancy cannot happen with that condition. The ovaries, they are full of multiple cysts. The tubes are not open. So how come without IVF? This is only God. Science, we cannot explain how I got pregnant, but to God be the glory. I just got pregnant. It's a miracle. I didn't eventually went for the surgery,
My sister, let us pause before we continue. One of the goals of this channel is how we explore our faith in navigating life challenges. And it's so interesting that your story is coming up at this time and the way God is, just writing the story. And as you have had my friend and my sister tell our story today, see the level of complications, see all that she has gone through. Stage 4 endometriosis, multiple fibroid, enlarged ovaries. What else? PCOS. Blocked tubes and all that, and see how God came into the picture and changed around the narrative. And I say that, and that's why I said let's take a quick pause. I say that to let us know that even as we're talking about all these challenges of endometriosis, there's still the God factor in there.
Exactly.
There's still the God factor. God is the writer of our story. And Let me tell you, if you're out there and you're dealing with endometriosis, you're dealing with PCOS, you're dealing with infertility, it is not over yet. And I do not want you to write yourself up, because God is still in the business of rewriting the story.
Exactly.
God is in the business of rewriting the story. So I just want to put that out there. Do you have any words of encouragement that you want to give to our audience?
For as many people that are suffering from endometriosis, the doctors will say,
just on this matter,
yes,
just in this area,
yes, the doctors will say there's no cure. And for my own case, they told me there was no cure and I could not conceive naturally. But it happened for me. You know, my faith. I will also put this before I continue. I wrote about my testimony. If you just Google my name, you'll see it on Google, Folashade Adesaalu, the story of fruitfulness. How I use my faith to receive my miracle, because it's a whole lot for somebody to have all these diagnoses. Like, I have like 7 or 8 diagnoses of infertility. It was too much. It was overwhelming. No single doctor can help me with all this. Even if I am to, I went for the procedure or the surgery. There's no guarantee. Exactly. There was no guarantee that I would conceive naturally or through IVF. So I just want to put it out there that if you're going through this phase, this, condition, don't lose faith.
Don't give up.
Don't give up. Just believe. If you want to seek medical help, go for it. Yeah. Seek medical help. There are a lot of medical help out there. It could be surgery, it could be, hormonal therapy, or all kind of, depending on your situation. So just go for it.
Yes.
And keep trusting God.
Yes.
Because at the end of the day, it's God that helps the doctors. It's God that heals us. Thank you.